Hello everyone and welcome back. I wanted to take a few minutes to talk about some of the more common betta illnesses and diseases that I've seen over the many years of raising bettas. Before we jump in, I think it's important that we accept the fact that bettas are similar to human in regards to illnesses and diseases. Bettas too can get sick just like you and I. They can get infections, parasites, inherit chronic diseases, especially at adult age. It gets even worse when bettas are inbred through multiple generations. It's because of inbreeding that we're able to create beautiful bettas, which I'll explain more in detail later. Due to high cost and low to no profit, there's not an abundance of fish doctors or surgeons. Would you want to go to 6 to 10 years of medical school, incurring $100,000 of student loan to become a fish doctor? I don't think so. The cost outweighs the benefit. You most likely will never be able to pay off that student loan, yet make a decent living to feed you or your family. There's also no X-ray machines, chemotherapy, or blood transfusion available for bettas, so this leaves us to become the doctor for our bettas. With that said, here's a list of betta illnesses and diseases that I have personally battled with over the 29 years of breeding and raising bettas, with the most to least common, and we'll discuss some treatments as well. There's already a ton of videos and articles on how to treat Finrot, so I'm not going to hack on that topic too much. Finrot mostly occurs with longer tail bettas, and what I mean by longer tail is I'm referring to your veil tails, your half moons, sometimes spades, and etc. Because their tails are longer, they tend to drag them on the ground, and sometimes they'll even bite their tails. All of this causes the caudal fin to not heal, leading to infections and rotting. You're going to hear this a lot in this video. If your betta is in a community tank, isolate him into a hospital tank. For those that aren't familiar with a hospital tank, it's just a container by himself, and I'm going to recommend at least a 5-gallon bucket only because 5-gallon buckets are common and cheap. Also, most fish medications are designed for 10-gallon tanks, and using a 5-gallon bucket just makes it easier to measure medication. Anyhow, find a way to keep the temperature between 78 to 85 degrees and add a teaspoon of non-iodized salt. Now you don't have to use a 5-gallon bucket. If you're comfortable using a smaller container, by all means, proceed with it. Obviously, the smaller the container, the smaller the amount of salt you use. Feed sparingly, just once a day, and do your regular water changes. Give it a week, and if that doesn't work, you can move on to antibiotics. API Finrot medication has worked well for me. Instructions on how to use this medication will be on the package. Ick is common with all aquarium fish. It's very noticeable because your betta will be scrubbing their bodies against objects. They'll have clamped fins or white spots. I recommend doing 100% water change. Scrub down your tank, add salt, feed less, and crank up the heat to 85 degrees. In a week, if that doesn't work, refer to the medication ICX. Popeye is exactly what it is. It's an infection in the eye that usually makes one eye swells and pops out. It's caused by dirty water or exposure to a certain unwanted type of bacteria. By the way, this isn't your normal beneficial bacteria that helps control ammonia. It's completely something else. Check your water parameters first, and then you're going to have to treat your bettas with antibiotics. I don't know of another natural way to heal this but antibiotics. It's a little pricey, but I use Canaplex and it's worked best for me. Dropsy. I do not wish dropsy on any of your bettas. If your betta has dropsy, please be honest with yourself. Did you feed your betta mosquito larvae, live blackworms, or bloodworms? In my 29 years, I've never been able to fully cure dropsy. I don't believe there's a permanent cure. All of my bettas with dropsy will eventually die, even if I was able to treat them early with medication, and they seem to have recovered. Over time, dropsy damages the kidney, and it would only make logical sense that the only permanent cure is to have a kidney transplant. But you and I know that's not realistic. It's probably best that you consider euthanizing your Betta. With dropsy, it's more of a prevention than anything else. Try not to feed mosquito larvae, live blackworms, or bloodworms, and you should be fine. If you're not breeding Bettas, you will most likely never see Fluke. I experienced a lot of Fluke breakouts in my first 2 to 3 years of breeding. Fluke permanently damages the gills and causes the gills to open. I don't know where Fluke comes from, but all I know is that this illness occurs when there's too much beneficial bacteria and seems to happen often if I don't deep clean my grow-out tanks. I know, you're probably asking, isn't beneficial bacteria supposed to be beneficial? Again, I feel like when there's too much beneficial bacteria, things get out of control and Fluke breaks out. I've even tested my waters and it has 0 ammonia. If you're unlucky like me and you're seeing Fluke, do not waste your time using heat or salt. They don't work. Just go straight to a medication called Pro. This is the correct medication and treatment. And don't forget, you also need to completely wash your tank. Ever since we started doing this, I think we've only had one Fluke breakout about 2 years ago in one of our grow-out tanks, and that was because we overcrowded and overfed that tank. As mentioned in the introduction, when it comes to diseases and cancers, Bettas are not immune. They come from imperfect genetic lineages, and it makes things even worse because breeders like me and many others sometimes inbreed family members to create a certain type of fin, coloration, or characteristic. Let me give you an example. Let's say you want to create a blue-red half-moon plakat. So you buy yourself a beautiful half-moon dad, then you buy a solid blue plakat mom. Together, they make little Timmy. However, 6 months later, little Timmy matures to a young adult and dies from a tumor. Frustrated at the situation and angry at yourself for not doing more to save Timmy, we set on a journey to find out what really happened. Upon digging into Timmy's family history, we find out that Timmy's grandfather on his dad's side also died from the same tumor. Grandfather had a tumor, but grandmother did not, so that makes Timmy's dad a tumor carrier. Because dad doesn't have a tumor but carries the tumor gene, we call him a silent tumor carrier. On the other hand, Timmy's mom's mom, which is also his grandma, died of a tumor too. Because mom's dad or Timmy's grandpa does not have tumor, Timmy's mom is also a silent carrier. I know, this all sounds confusing, but follow along and I promise you get the idea. So now we have 2 adult silent carriers that have spawned together, and most of their offsprings, like Timmy, will be active tumor carriers and will eventually die of tumor. One of the reasons why I think wild Bettas are more durable when it comes to illnesses or cancer is because they don't do selective breeding in the wild. Because of that, wild Bettas often don't have good coloration or finishes. It's only those wild juveniles that have a strong immune system, making it to adulthood, be able to fend off other males, are able to have the opportunity to spawn. As goes the saying, it's the survivor of the fittest. All the weak links with cancers and tumors would have already died off at a young age. One of the lines that I've been breeding for over 3 years now is this blue marble plakat line. I call it the Frozen line because my daughter said that this color reminds her of Disney's Frozen movie. I've gotten to the point where they're breeding over 50% blue marbles, but the downside is that I'm beginning to see imperfections. I'm seeing a few with tumors, and so to repair the bloodline, I need to breed in a different blue marble bloodline. The objective is to hopefully bring in a bloodline with no tumor or not a similar tumor genetic. Because of COVID causing transshipping delays, I've held off on bringing Bettas in from overseas. Of course, I can jump online and buy Betta in the States, but I've spent way too much valuable time with this line that I don't want to risk breeding them in with a betta that I have no trace of or the history of its bloodline. Who knows, I may have to if COVID continues to spike, because in 2 months, all the females should be ready to spawn.